All right, Gayle Keagy, welcome to the show.
Thank you.
So you are here to talk about your experience training our students in CPR, but I'd love if you could just provide an introduction about who you are and what you do here at MBIT.
Okay. Gayle Keagy, obviously. I've been at MBIT, I guess, full-time about 5 years. I helped in the public safety program between 10 and 12 with firefighting and EMT program. I have 34 years in the field of fire and emergency medical services. I'm still active. I'm still an active firefighter with Covelle Fire Company, and I work for the city of Philadelphia, providing EMS to the Phillies, the Eagles, any major recording artist that comes in town.
I imagine that you have quite some stories to tell.
I do. I got to be the personal EMS person for Mick Jagger. The Rolling Stones are my absolute favorite band. I can say that because I didn't actually treat them, but they were awesome, awesome band.
Excellent. I can only imagine what fun that is to participate and be inside of those environments.
It is. It is. It's a lot of stress, though. I ran the medical for them. So when you have 80,000 plus you have to take care of, it's a big job. But I do enjoy it. I have a great crew, very experienced crew, and lean on them heavily. And my job is to steer the ship, keep it upright, and provide good customer care.
And how about here at MBIT? What's your role?
Well, I'm an instructional assistant. And as of this year, I'm also a resource teacher. So Ms. Doherty had approached me to ask me to teach CPR for the students in the building. So she put a calendar up for the instructors to sign up. So far, I have instructed 122 students on CPR. I've actually taught them CPR, and all 22 have been successful to complete the class. And they've earned 2 certifications out of it, CPR as well as AED.
So I want to spend most of our time talking about that because I think that is so incredible. So right now it's about midway through the year. You've already instructed 122 students, and all of those students are now certified CPR
AED,
mm-hmm. which is absolutely incredible. So let's just go back just a little bit. So what motivated you to pursue this path?
Well, my uncle was a Veteran Life member of Northampton Fire Company. And when I was very young, able to walk, he started taking me to the firehouse. So he was helping people. And my aunt was also involved with underprivileged women and children. So they both said to me to give your time freely to those that cannot help themselves. Volunteer. So I caught the bug around the firehouse with him. And anytime I stayed with him, which was quite a bit, he would bring me to the firehouse. Now, mind you, he had 3 daughters that never went to the firehouse. I did. So I was quite honored. So he was very supportive of me, and he was a great guy. And that's why I learned to help people. I got to see a lot of things. So when I got old enough to join a fire company, I did. And when I got involved, I thought, I really want to teach CPR because my very first medical call, I did CPR.
Is that right?
Mm-hmm. And I thought after that, I want to be able to teach that. So I've essentially been teaching CPR for 33 years.
Wow.
And it's wonderful.
And so and I know that you don't just train students, you train all kinds of in-service professionals as well in CPR. Can you talk about that? That's
true. Every August before school starts, I go around to different school districts and I recertify or certify the teachers. Right now, I teach fire school as well. I'm a Pennsylvania State fire instructor, so I'll teach that as well to our up-and-coming firefighters. And I'm booked solid until April, going around to fire companies in all different counties teaching CPR.
Wow. So in terms of this initiative here, I know that we here at MBIT take heart health very seriously. And as a team, we discussed a way to try and certify more students. And quite honestly, our goal is to certify every single student here in CPR AED. We would feel really accomplished if that was the case. And we knew that you were critical to helping us do that. So first off, thank you for helping with that initiative. Can you talk about your process of trying to implement that and how you stay organized and we have 21 career technical programs, so that's a lot of complication. Could you just talk about how you organize yourself around trying to get that done?
Well, they sign up on the calendar and they get scheduled. I do all my prep work, all my paperwork, and all the mannequins, everything ready for them to go. You got to keep people motivated, and you have to get them involved and want them to actually do it because some people are actually scared to even touch a mannequin. So I'm very animated. I walk around a lot. I get very excited about it. Keep the enthusiasm up. And I say to them, even if you just touch somebody's chest and do chest compressions, you're helping somebody. And I said, each one of these students, by the end of it, I said, we had a cardiac drill in here, and if it was real, out of just a drill, I know I can tap a lot of the students in the building that would absolutely help. I had one student, I asked him, why do you want to take this class? Because some say, oh, my instructor made me sign up. And he said, I want to help my family. If my family had an emergency, I'll know what to do, and that's why I'm here. That's terrific. That's the goal. So he wants to help.
I'm quite certain that you've got stories about people that you've trained, that you've been able to hear back that they were able to use the skills that you taught them. Can you reflect on any of those moments or any times you've had to use the CPR training?
In terms of students, I mean, I've been teaching for so long that I have grandbabies. I've taught parents, I've taught their kids, and that such and such. So I'll actually see them on the street sometime, and they're doing it. They're doing what, I've showed them. So that makes me so proud to see them on a call. We had a cardiac save at Lincoln Financial during a football game, and I actually trained those folks that were part of my crew.
Wow.
I did receive an award, some accolades, which was very nice of the Eagles. But, it's great to see them actually out there. They're doing it. You know what I mean? That's what makes me so proud. And, the students here, they're going to have to use that skill eventually.
Well, and so that leads to my next question, which is, why do you think that CPR training is an essential skill for all students, regardless of their career aspirations? Why do you think it fits?
Because you can help somebody. The American Heart Association tries to get at least, I think it's like 10 or 20 million people trained every year, because out-of-hospital cardiac arrest happens all the time. And right now, only 10% are making it because people aren't helping. So the more you get people trained, the more they're willing to help. Right now, we have AEDs everywhere. Like our school is putting more AEDs in the building, which is terrific. But only 9% of the people actually want to touch an AED because they're afraid. So to get over that fear and say, it's just really, all we're doing is mimicking the heart. That's really what we're doing. It's easy to do. Everybody can do it. I want people to engage and not be afraid to help somebody. That's the big thing. We want to help each other. This school is great with, providing the nutrition, the exercise, the curriculum, which I think this was outstanding to offer this to the students to get trained. Myself in the field, it has worked. It has worked a lot of the times. I've been amazed, the people that come back from what they did. The gentleman at the Lincoln Financial Field, he had a very high blood alcohol level that I was surprised he came back, but he is fine without any kind of deficit. I saved one lady with the help of all my crew at a nursing home. And the one gentleman from my fire company, I got him in the ambulance with me, and he saw what CPR is really like, and he went, wow. And I said, yeah. And she came back.
Wow.
And no deficit whatsoever. And I visit her every single year on her anniversary to say, still here.
Wow.
It's a very good feeling. It is frightening the first time you do CPR. Trust me, it's not like a mannequin. But once you do it once, you're like, you're just there to help somebody.
And so in our 21 career technical fields, I'm thinking right now about early childcare. Do you teach the early childcare students how to do CPR? Do you teach all levels of CPR or just adult CPR?
I do all levels. We do Heart Saver right now is basically hands only for the students, and I mixed in the AED. I teach some generic AEDs as well as our AED specifically. Childcare, it's more like a basic life support, which adds a pediatric element, and I can teach that as well.
Okay. So in terms of the different program areas, which program area do you think, or do you have any experience sharing about which program area really did a great job with it, or who was super engaged? I imagine your public safety students were all over it.
Yes, they were very engaged. I have to say the ones that I think all the programs so far that have participated, I think the students have been awesome. Nervous to do it in front of others, as you know, that is peer pressure and that kind of thing. But I have to say, really, so far, the culinary students, because you're going to think about that. Choking happens a lot in the field. We're in a restaurant, somebody's choking. People end up getting full obstruction in their air, and leads to respiratory arrest, leads to cardiac arrest. So you're going to see that a lot. And they were really engaged learning how to do that.
I guess I never thought of it that way. That's a really good point. I'm glad to hear that. I'm glad that I asked. What about feedback? What have you heard in terms of feedback from whether it's students, parents, or instructors? Talk about that if you would.
I have to say the instructors have been great, very complimentary to the students, towards me. I've gotten some shout outs from Mr. Sykes, from yourself. Mr. Stafford from culinary was absolutely thrilled. So was Mrs. Taylor. I just did web design with Ms. Halton, and she was thrilled as well as with the students. So it's nice to get that really good positive feedback. I really do enjoy that. Makes me sure that I'm doing my job correctly.
Well, and I appreciate that that you're helping us with this initiative. I know we couldn't do it without you, so thank you very much for that. And the idea that all of our students and all of our staff as the goal to have everybody, every single person here trained in CPR AED, that would be, it's a huge undertaking, and it would be a great accomplishment if we could get there. And you're a huge part of that. So thank you very, very much. Thanks for sharing your experience. If people are listening and they're interested in finding out more about getting CPR trained, where could they get more information?
Ms. Doherty sent out an email, and I think every week when she sends out the update, there's a calendar you can actually click on and sign up, or just email me directly, and I'll be happy to schedule it.
What about outside of MBIT? What if folks in their schools, they're hearing this, other CTE schools, wanted to learn more about where to get training with the American Heart Association? Where's the best place to go, you think?
Yeah, American Heart Association can probably hook you up with somebody. I work directly out of like Bucks County Community College or training centers, but there are places out there that you can book, or they can contact me. And I'm a roadshow. I travel everywhere with all my mannequins. I have another assistant instructor that comes out with me, and we're kind of like a dog and pony show.
Well, there you go.
Because we want to get more people, trained. And my goal is, along with yours, I know Ms. Doherty, to get everybody in the building trained.
Now, will they get stories from the link when they get you as a trainer on your roadshow? Potentially?
Maybe. Yeah, people do post things. We just finished teaching at Elkins Park Fire Company the other night. And those guys, some of these fire companies are fun. I was raised around a firehouse, and they were just terrific. They just really enjoy it. And they said, we have finally found, after all these years, the instructor we've been looking for. And I think that's a great compliment.
If in your training of all of our students and all of our faculty, we help one person, then that's enough. And I'm glad that we're doing it. So thank you again for your time and your effort and your energy and your knowledge and sharing that with our students and faculty here. Thank you.
Well, thank you for allowing me to do this. It's great.
Ambitious is a student-produced project of Middle Bucks Institute of Technology. To find out more about MBIT, visit us at www.mbit.org.